support that you provide to this conference year after year and the role you play on the organizing committee. Before I introduce the next speaker, just a reminder for those of you venturing into the hall, we do ask that you wear your registration badge at all times. So next, it's my pleasure to invite someone I dare call a friend, a former colleague, Mr. Shomari Scott, the Chief Business Officer at Health City Cayman Islands. He has been with the organization since the inception as one of Health City's original employees. He's played an instrumental role with the team that has helped to shape the hospital's concept from a vision into the reality that it is today. Ladies and gentlemen, please join me in welcoming Mr. Shomari Scott.
Good afternoon, ladies and gentlemen. And those, I guess I don't speak to too many healthcare groups because persons know that my mother's a teacher. So when I say good afternoon, I expect a raucous good afternoon back. Good afternoon, ladies and gentlemen. Mr. Scott. Okay, all right. Now, don't talk about the Dolphins, don't talk about the Dolphins. But I just want to say it's protocol being established. It's an absolute pleasure to be here. I, however, got really nervous as I entered and looked at the agenda and saw that Dr. Jeff was slated to go before me. And the reason being is that I've heard him speak many times, even at graduations and the such, and he also always does such a great job. I was saying, how am I going to come behind Dr. Jeff and do a good job? But he definitely helped to wake me up. I have a little bit of jet lag. It's about 2 o'clock where I would have been in the morning, where I would have been 2 nights ago. So, 2 a.m. without a rum in hand means if I'm falling asleep, I don't have dropsy, as you Caymanians would know what that is. It's just a little bit of jet lag. I think I need that fritter with mango jam to give me that extra boost. And I say that without looking to the far left because Dr. Suki is giving me the evil eye. I'm just thinking about it. I'm not doing it, Dr. Suki. So as I said, I'm thrilled to participate in yet another installment of the Cayman Islands Healthcare Conference. A healthy community is a goal we all have in common. So it's great to be here to partner with the various entities and stakeholders for this year's event. With partnerships being such a key component of an effective healthcare system, the theme bridging the gap between patient and practitioner pathways to optimum health is quite fitting. Permit me these few moments and minutes to bring your attention to the importance of the partnership between the patient and practitioner from a non-physician perspective. Now, you're going to hear all of the technical information moving forward, but hear from the non-technical information, and I will go from the actual aspect of a patient. Whether or not I've been a good patient, you can ask Dr. Suki after this to see whether or not that's true. Pathways to optimal health. It's a journey. It actually reminds me of the legend of the riddle of the Sphinx. What has one voice, goes on 4 legs in the morning, 2 in the afternoon, and 3 in the evening? I will keep you in suspense because I know there are a lot of studious people in here, obviously, that would know the answer to that riddle, so that at the end of the speech, I'll definitely see who understands the riddle. So the tenets of relationship. A few key tenets of the patient-practitioner relationship, as I've identified them, are trust, reliance, satisfaction, and longevity. And I promise I did not see Dr. Jeff's notes before this and copy off of him. It just shows you that great minds think alike. As we go through life, we will often find that outside of family, there are few others who sojourn with us. Included amongst those elite few is our healthcare practitioner. In some cases, we're lucky to have the same doctor from infancy to adulthood. Doctors are human too. I work with quite a few, and some believe that they're not, but they are human too, and sadly not immortal, and don't usually last from childhood to still be practicing when we are gray. They therefore hand off that baton during various stages of our lives, ensuring we receive the requisite levels of nurturing care to promote proper development and long, healthy lives. As a child looks to his parents, as an adult looks to his spouse, as a senior to his children in the golden years, so too do we look to our healthcare practitioners at every stage of life's journey. Trust. Trust is perhaps the most critical component on which this partnership rests. Patients invite doctors into the most intimate aspects of our lives, seeking their guidance through very complex and often intimate aspects and delicate situations. The truth is, our doctors know things about us that we wouldn't dare tell another living soul. If a doctor is open and empathetic with sharing information with patients, not only will they have a deeper understanding of what is ailing the patient, as the patient will be forthcoming about their condition and symptoms, but trust will occur. A mutual trust that is a critical element in the success of the patient-practitioner relationship. Reliance and satisfaction. For the patient who enjoys trust and positive outcomes, a reliance on his/her physician for holistic healthcare is a natural offshoot. Such a high-quality relationship will lead to patient satisfaction, and the patient will have concluded that he or she is able to rely on the physician, and their expectations have either been met or indeed exceeded. Continuity and longevity. The patient-physician relationship is one that requires continuity for it is to be sustained. From the patient's perspective, this continuity may mean switching from a pediatrician to a GP as we enter adulthood, or continuing to receive care through a new relationship after we move on to a new physician. Regardless, we need to ensure, and I'm speaking to the men in particular, and DG spoke to this, that we don't miss that handoff, which many times as men we do. That gap from pediatrician until we're more mature. We need to ensure that we keep the baton moving smoothly. Otherwise, our healthcare journey would be akin to a 4x100 meters relay where the first two legs are run brilliantly. However, there's no one on the third leg to hand that baton off to Usain Bolt to bring it home, and a potential world record would be lost. In addition, when we find a physician we trust and are satisfied with the level of care provided, that relationship will continue over time, establishing longevity. The relational model. Evidence shows that patients often seek a strong relationship with their primary care physicians because of their need for dependency, as well as their own lack of knowledge. Against such a backdrop, it's easy for this to become lopsided and a one-sided affair that is dominated by the medical practitioner, one in which the patient is nothing more than a passive bystander. Or to the other extent, like the DG mentioned, Dr. Google is heavily featured by the patient to the scorn of the physician, leaving the patient to research and engage no longer. Ladies and gentlemen, healthcare should continue its evolution to a more patient-centric relational model where the focus is on high-quality interactions built on effective communication, which leads to mutual trust, reliance, satisfaction, and longevity. Rather than the physician's role, that being the only expert providing technical expertise and knowledge to a patient who passively accepts. The relationship must now become a symbiotic one, in which both participants exchange information and are actively involved in the healing process. As I conclude, let me emphasize the importance of a shift from the traditional stance, where the focus is on the technical expertise and knowledge of health providers rather than interpersonal skills, to a combination of these. Effective healthcare means delivering high-quality solutions with expertise, reliability, trustworthiness, and empathy, all of which are important to today's patients. To our physicians, you are the coaches, the ones with us to ensure we win in this game of life. By optimizing our health, you help to serve our patients, bringing the best out of our individualized excellence of a life lived with purpose and health, where we squeeze every ounce out of the greatness of the game of life. We need that coach or coaches every step of the way. I mean, if I was currently at a press conference right now, let's say the game of life for Shomari. So Shomari, who do you give credit for reaching so far and achieving so much in this life's journey? Great question, Bob. Well, first of all, I'd like to thank the Father above. Without him, nothing is possible. I'd like to thank my mother, my father, my gorgeous wife, and how can I forget Dr. Cridlin, that helped me, nurturing me as a child? How can I forget the National Cayman Islands? Journalists are not supposed to be clapping. Dr. Cridlin, that nurtured me through my life, and then also the Cayman Islands National Youth Basketball Team coach, and also physician, Dr. Marzuka. Couldn't do it without you. And then, as stubborn as I was when I came back, Dr. Sidney Ebanks, that took me through those formative college years. And last but not least, how can I not thank the doc that brought me right here to where I am right now, Dr. Sukiyin, Dr. Suki, who always called, texted me, phoned me, saw me at receptions. She should have played basketball, gave me that elbow to the rib, saying, I haven't seen you, Shomari. I need to see you. I'm going to call you. Come see me next week, to make sure that I always saw her every year like clockwork and made sure that I took care of myself. Without them all, where would I be? And that's the patient and practitioner partnership that's interwoven like a glove that makes everybody's life as best as it could be. No more questions, Bob. That's the end of the press conference. I'm going to go to the locker room now to relax. But I just use that as an example to show how we can all win at the game of life, physician and patient working together. I forgot to put on my gold medal from all of the doctors that helped me in winning at the game of life thus far. And I couldn't leave you without the riddle of the Sphinx. What has one voice, goes on 4 legs in the morning, 2 in the afternoon, and 3 in the evening. Does anybody know? All right, there we go. It's a human being who crawls as a baby, stands on 2 legs as an adult, and walks with a stick in old age. Each phase distinctly different, but all vitally important. However, that shadow that follows each of those stages, that acts like a sage following, is our trusted coaches, the practitioners, the physicians, preparing, instructing, and championing us to win in the most important game, that game of our health, that game of our life. And I leave you with the words of Carl Jung, who said, medicines can cure diseases, but only doctors can cure patients. Thank you, and I look forward to ensuing discussions and presentations over the course of the conference.
Clearly, I didn't get the memo that I was supposed to introduce him as Mr. Champion of Life, but thank you, Shomari, for that eye-opening presentation. Thanks as well to Health City for once again stepping up as the Premium Plus sponsor for the conference.